This is Viral Diseases Part 2. And our next virus is smallpox or variola. This is in Group 1. It's actually was a super deadly virus. It killed an estimated 80% of the European population in the Middle Ages. And during the settlement of the Americas, North America specifically, with the European settlers, they brought smallpox over, and it ended up killing massive amounts of Native Americans, which is pretty crazy how deadly it was. So it's caused by what they call a pox, which is the name for a lesion that is filled with pus, and it can actually burst. And the pox virus can be transmitted from those poxes and also through the respiratory route. So it migrates to the skin and causes these horrible lesions that you can see here in these images. And it's the first disease to which immunity was artificially induced. If you remember, we talked about the milkmaids who were exposed to cowpox. They might have had, the infection and the symptoms of cowpox, but when they got exposed to smallpox, they would survive. So Edward Jenner noticed that trend and used that to expose people to cowpox so that they would be immune or have somewhat built up immunity to smallpox. And this is one of those awesome cases where through, mass vaccination programs, they were able to actually essentially eradicate this virus. The only place that it's left is the United States and Russia actually keep the smallpox virus so that if one of the other countries would try to use smallpox as a weapon of war, that the other country would be able to respond with the same thing and also would have that virus to be able to develop vaccines. Next one is measles or rubeola, and this would be extremely contagious, could be transmitted through droplets. Some of the symptoms, of course, will be a fever. You'll notice a lot of the symptoms are the same for essentially everything, but the severity of those symptoms might be different. But so many viruses will cause all of those things that you see there. But what you need to remember are the things that make that virus different from the other things. Don't try to remember that everything causes a runny nose and a fever, because then you're just going to feel like everything blurs together. So for measles, it has these signature red spots they call Koplik spots, and they can appear in the cheek pouches of those who have been infected with measles. Now, this is one of those viruses that only humans can get. Some viruses can be transmitted from animals to humans. And then, of course, they have the combination MMR vaccine, and that stands for measles, mumps, and rubella. And that's to develop immunity so that when people are exposed to measles, that they do not have some of the more severe symptoms of that virus. Now, there's some interesting trends with vaccination and, of course, the reported cases of a particular virus and the mortality and like the reported deaths from those infections. And generally what you see is when there is a vaccine that is distributed and it starts to become widely available, you see a massive decrease in the rate of infection of that virus. And that's because if you are able to build up immunity to a virus and then you are exposed to it, there's a good chance you don't even develop any symptoms from it because you've developed immunity. Your immune system has developed immunity to that virus, so it doesn't have all the horrible symptoms that can come with some of these viruses. And the good news about the viruses is a lot of these, most people aren't going to die from these viruses. But you might have, for example, there might be some type of brain swelling, encephalitis, or you might have swelling in your meninges. And then that could cause long-term effects in somebody's body and in their brain. So the idea is more of not that the vaccine is necessarily going to save your life, although it could, but generally it's going to prevent having the more severe symptoms that you probably would have recovered from on your own, but it's going to prevent those from happening in the long-term damage that they might have caused. And another thing that's good about vaccines is as long as a very high percentage of the population gets them, then it creates a kind of herd immunity for those few individuals who, for whatever reason, do not get the vaccine. So as long as a very high percentage who are getting that vaccine, the chances of having outbreaks are small, because if someone gets it, they might be surrounded by a community of people who are already vaccinated, in which case the risk is more isolated to that individual who chose not to get that particular vaccine. And this is just showing you those Koplik spots that can show up on the inside of someone's cheek in their mouth area. So that'll be from measles. They have something what they call German measles, which the name for that is rubella. That measles, mumps, rubella vaccine would protect against this as well. And a lot of these normally have pretty mild symptoms, but then in the rare case, you're that person who has horrible reaction to that virus. It's great to already have immunity built up so that when you are exposed to it, the symptoms are, not going to be a problem for you. This one's really dangerous for if it's contracted during that first trimester during pregnancy, and then it can create much more serious conditions for the developing baby. So that brings us to mumps. So this one can be transmitted through airborne particles. And what it causes is these signature enlarged salivary glands in that parotid in front of the ear area. And in males, it can also infect the testes. It can become localized to that area, which can decrease the sperm count. So MMR is going to give you protection from all three of those viruses. Just doing a little research because to me, it kind of helps to picture what a virus is like, what it's doing in the population, to just look up what are the cases of this particular virus, what's happening to people when they get it, what is the vaccination rate for a particular virus. It's just very interesting. But for mumps specifically, if you look in the past, there'll be these huge spikes where the cases got, there's a huge outbreak, and then a lot of times they'll be isolated, and then it will decrease a lot. So sometimes what will happen is there'll be like one large community that has not been getting that particular vaccine, and you'll have an outbreak in that area. And that happens all the time. And usually those are pretty normal. And we particularly saw something interesting in 2006. And this was seen mainly among college students who were living in dorms and who were like living on campus. They were vaccinated individuals who were actually having these reported mumps case and the symptoms of mumps. And there's a few different theories on why it was breaking out in these vaccinated groups. One of them was that the vaccine was not, its effectiveness, the particular one that they were using at that time, its effectiveness was decreasing to the point that these people started to have the expression of the virus. So it wasn't providing them the protection that it was supposed to. There was another theory that even though they had been vaccinated, that the vaccines that they had, those individuals, for whatever reason, their antibodies had decreased over time to the point that it was no longer providing them with immunity. Then we have what's called fifth disease. So this is erythema infectiosum, and this is caused by the parvovirus. So it's just like the flu as far as the symptoms go, with this added slapped cheek rash that people will get on their face. And you can see it there in those two little boys. So that brings us to polio. So this is caused by a virus that generally comes in contaminated food and water and contaminated with feces. So the paralytic form is actually extremely rare for someone to actually be paralyzed by the polio virus. And it's also insanely rare for someone to even get polio nowadays in the United States, due primarily to good hygiene, septic systems, and high rates of vaccination against polio. So in America, the chances of someone getting it, we'll talk about the different vaccines they have too in a minute, is very, very low. So from the blood, it can enter the nerves and cause paralysis by destroying the spinal motor neurons. So because it's housed there, it causes damage there. So there's all kinds of really interesting and moving and sad stories of these children who got polio in the 50s and then how their life changed as a result of being affected by the polio virus. So there are many people in the world today who still get polio, especially in areas where they don't have access to the vaccine. And not only just that, but having access to clean water, having access to septic systems, just a building with modern plumbing significantly reduces the chances of spreading polio because it's spread in feces. So if you can get the feces away from where the people are, then you're immediately decreasing the transmission of all of these diseases by a massive amount. And you'll notice a correlation between decrease in the spread of these types of diseases and the widespread use of septic systems and plumbing. So with polio, when it started to break out, they had the paralysis that would come from it when it affected it would be about 1 in 200 people. 1 to 100 to 200 people would get paralyzed of those who had symptoms of polio. And one of the things they had to do, because it would shut down their nervous system, they would become paralyzed. Some of them would recover from that and learn to walk again and live a normal life. And then later in their life, they might have the infection come back if they got really sick when they were older. And then the symptoms of paralysis would actually come back as well. So at that time, they developed what's called the iron lung. And basically, it's just a huge machine that creates negative and positive pressure so that those who can't breathe on their own, because they can't use their nerves to control their diaphragm, that the machine creates negative pressure to pull air into their lungs, and then it compresses to push the air out of their lungs. So it's basically just a massive ventilator that these people are on. Now, one of the more famous people who are still alive who had to use an iron lung was Paul Alexander. And I remember learning about him years ago. And when I was studying for this course, I was sad to hear that he actually passed away last year. So he was paralyzed as a boy from polio, and he had to live he was in there all the time just to be able to breathe in the iron lung. And now the last person alive that still uses this iron lung, which just looks like a huge submarine, is this girl named Martha Lillard. And her story is when she was 5, and it's super sad. Like, she wanted to be a ballerina. She loved to exercise and run and play like any 5-year-old would. And at a kid's birthday party, they were eating, I believe it was pancake batter out of a bowl. And they were going to make pancakes with it, and all the kids were just eating out of the batter. And polio was in there. Some of the kids got sick. She woke up a few days later with a sore throat, and then the condition, as the virus started to express itself, she eventually became paralyzed. And she had to learn to breathe with this iron lung. But she actually relearned how to walk again, how to breathe on her own. She said when she first would try to breathe on her own, they'd try to teach her to breathe for 30 seconds on your own, and then they'd put him back in the iron lung so they could breathe again. She said it was just exhausting, like how hard it was just to breathe. But she eventually learned how to breathe again, how to walk on her own, and lived a pretty normal life until not that long ago. She got really sick with pneumonia, and the stress caused the polio virus, to come back. And then she had temporary paralysis again. And now she actually can be up during the day, but she has to sleep in the iron lung at night to be able to kind of catch her breath from wearing herself out all day trying to breathe on her own. So it is a horrible, horrible virus. Her advice, I read an interview pretty recently of her, and she was just saying, get vaccinated. That was her encouragement. So I would also be respectful of that, to just share that was her thoughts on it. And I definitely respect that. So we have a few different vaccines for the polio virus. They have what's called the Salk vaccine and the Sabin vaccine. Now, for the Salk vaccine, this one uses inactivated viruses. So they're inactivated. They're not going to, express themselves in your body like a live or weakened virus might do. These are given intravenously. They call it IPV because it's inactivated, and they just give you these as a shot in the shot form. So that's the Salk vaccine. This is what we do. We give inactivated form of polio, and that's all they give in the United States, insofar as I recently read about it. And they give it in the shot form. The Sabin vaccine contains 3 live attenuated, so they're live, but they're weakened forms of the virus, and they're given orally. And that's why they call it OPV for the oral polio vaccine. And this one was really popular because if I don't have to get a huge needle stuck in my arm, then, a lot of people would prefer to get the oral polio vaccine. But the problem is, because it is a live virus, it could actually be spread from person to person if they got the oral polio vaccine. So that's why they stopped using it in 2000, and now they use the IPV instead of the oral polio vaccine. Although it is very rare for that to happen, for someone to get an oral polio vaccine and then to spread polio, it is technically possible, and it has happened before, which is pretty crazy. That brings us to rabies. So again, you want to be remembering what makes this virus different. Well, rabies, it has a bullet shape to it, which is pretty unique. It's nearly 100% fatal, and then, of course, it's going to come from wild carnivores typically, and then, of course, from them, it can be spread to people's domesticated animals. And it's going to be transmitted by a bite. If someone gets bit by a wild animal, and maybe you don't know if it had rabies or not, let's just say it just seems like it was a rabid animal because of its behavior, for example. Well, then they have a few, like what they can do is, because it takes so long for the rabies virus to actually get into your central nervous system, they can actually give you the rabies vaccine that day that you got bit. So don't not go to the doctor and think, well, we'll just see what happens. Like, go to the doctor, get the rabies vaccine. And then they also can give you something called rabies immunoglobulin. And basically what that is it's giving the person antibodies that will provide them with temporary protection against the virus, while it gives the vaccine time for their bodies to process and build up immunity to the virus. So the crucial thing with being bitten by an animal is to go to the doctor immediately so that you can get the rabies vaccine and you can get immune globulin. So one of the things you'll notice, because it affects the nervous system, and Pasteur noticed this, is that the animals start to act really crazy. And oftentimes they will be foaming out the mouth. If you see an animal act very aggressive that is normally not, for example, my neighbor had 2 raccoons approach him on our road just for no reason, and they were chasing him down the road. And they had to call animal control, and they think that those raccoons had rabies. That's in Lincoln, by the way, so watch out if you get chased down by a wild animal. Usually animals are supposed to be scared of you. If they seem very aggressive for no reason, then it could be that they have rabies. So for the arboviral encephalitis, or what they call ARBO, which stands for arthropod-borne virus, the vector of these is arthropods, which would be those animals with jointed appendages or jointed legs. So these cause inflammation of the brain. They have these different names named after where they come from. So Western equine encephalitis, St. Louis encephalitis, California encephalitis, etc. So for this, you're going to see that vector is the mosquito. So what they do is they would transfer the virus to the host, then the virus would replicate in the host, and then it would be transmitted to the vector as another mosquito bites the host, and then so on and so forth as it's transmitted from host to host. Then we have yellow fever, and the name yellow fever is for what it does to your body. So again, remember the differences between these viruses. Also transmitted by a mosquito, and the reason it's called yellow fever is because it makes people look yellow because it causes jaundice. So the eyes, the skin will start to turn yellow. And the reason that's happening is because it damages the liver, which leads to that buildup of bile, which is going to cause the jaundice. So mortality rate is about 20% common in Central and South America. And they're trying to show you there how it could yellow the skin of someone with yellow fever. And these are types of viral hemorrhagic fevers. So for this one, for dengue, this is actually common in South America and in Mexico particularly. It's also transmitted by a mosquito. It's basically yellow fever, but not as dangerous as yellow fever. And actually in Mexico, they have some maps that you can actually look up of where it's the most predominant, what variants are there, what are the symptoms, what are some travel guidance. And really the best thing is avoid the mosquitoes. So I know if you're going to Mexico, you want to be outside or on the beaches or whatever. You need to make sure that you have insect repellent. You wear long sleeves, things of that sort to avoid being bitten by those mosquitoes, which is where it's going to spread. And that brings us to Ebola. So for this one, this is one of the most deadly with a 90% mortality rate. The natural host, they thought, for a long time, they didn't know, have any idea where it was coming from. Now they think that it came from a fruit bat. And it's actually not extremely rare for a virus to come from an animal or a bat. When SARS-CoV-2 happened, or what we call COVID-19, when that happened, there was such a controversy over where it came from. And so many people were saying that, it's not possible to come from an animal, but that actually is possible, and it's happened before several times with several different viruses. So it's not far-fetched of a theory. It's just what was the evidence in support of that versus the lab leak theory. But just the idea of that does happen, and it has happened in the past. So this next one is the hantavirus. So this causes hantavirus pulmonary syndrome. And basically what happens is the lungs start to fill with fluid, and the person can't breathe. And this is transmitted when people if they're cleaning up their garage and there's dried rat urine and feces in an area, and you're sweeping up the dust into your nostrils and you're breathing it in, then you could actually get infected with that. And it happens in the United States. It's happened many times and continues to happen. So if you're ever cleaning up anything, it needs to have moisture on it, and you need to be wearing a pretty legitimate respirator if there is going to be any dust at all. Kind of like if you've ever had to, hopefully you haven't, but I've, through renovation, worked with some areas where you think it may have asbestos on it. And with that, you always want to have a steady spray of water because it captures any airborne asbestos fibers in the water and pulls them back down to the ground. And then, of course, you wear pretty intense respirators as well. So you can actually use that strategy for a lot of things, and it would also help in a situation like that where you don't want there to be dry dust of those substances. So you can moisturize them with bleach, and then you can start to clean them up while wearing a respirator, of course. Because water does do a good job of trapping airborne particles, especially with asbestos because it's a rock, so it has a magnetic field on it, so it can really get stuck into water very well. And that brings us to hand, foot, and mouth disease, or HFMD. And for this one, it causes these blisters and lesions on the hands, the feet, and the mouth of an individual. And that's why it's called hand, foot, mouth disease, obviously. Then we have the common cold. The common cold is caused by at least 110 different types of viruses, including rhinoviruses. You see that word coronavirus? That's a type of virus. COVID-19 was the coronavirus of 2019, a particular strain that we were observing at that time, of course, but coronaviruses have been around, for as long as they've been discovering viruses. So for the common cold, why don't we get, we get a flu vaccine, we get vaccines for all these different kind of viruses, but we don't get a vaccine for the common cold? And the reason is it just mutates so quickly. There's so many strains and so many types that can cause it that it just wouldn't be practical to get 110 vaccines every year for all these different variants of the common cold that you could get. There's just too many variants, and the symptoms aren't really very bad. You get over them very quickly, generally going to be pretty mild. So it's really not practical to get vaccinated for the common cold. So this next one is CRU. I'll try to pronounce this right. CRU is an easier word to pronounce, but laryngotracheobronchitis, or LTB. And it's called that because it causes inflammation of the larynx, trachea, and the bronchi. So it leads to this distinctive barking cough that people will get, or this high-pitched sort of breathing sound that they get from it. And it's caused by that HPIV-1 and HPIV-2 virus, or the human parainfluenza virus. So lower respiratory infection, and this is actually pretty common in really young kids. Then we have viral pneumonia. So this would also affect the lower respiratory tract. Could occur as a complication of the flu, measles, or chickenpox. So you've heard of bacterial pneumonia before, where you get a bacterial infection in your lungs. Viral pneumonia would be a viral infection in your lungs. So you're still going to get that chest tightness, shortness of breath, probably going to get a fever, chills, fatigue, similar symptoms to other viruses. But your lungs in particular is where you're going to have a major amount of that inflammation and, of course, difficulty breathing. So then we have influenza. So we have type A and type B. So this is what we call the flu. Think influenza. So this transmission is very quick. There's about 100,000 to 200,000 Americans who die every year from the flu, actually, which you don't think of that. We think of all these other deadly, seemingly more deadly viruses, and we get the vaccines for them. But the flu is actually killing way more than any of those are in America, still to this day, every year. And it's not because of the flu. It's because of typically elderly people, immunocompromised people who get the flu, and then it damages their body so much that they get these secondary infections. And typically, elderly people will get a secondary bacterial infection in their lungs. They'll get pneumonia, bacterial pneumonia, and then they'll die from that. So it's not really the flu that actually kills people. It's those secondary bacterial infections that they get. And then, of course, we know if you've ever had the flu, you know what those symptoms are like. Fever. You can usually get a pretty high fever, muscle soreness, aches in your joints. It might start with just a runny nose and a sore throat. A lot of viruses will start with that sore throat. You just wake up with a sore throat, and it seems like there's no reason for it. It's probably, could be bacterial or viral. So something's going on when you have that sore throat. So then we have the avian flu, which you should think of birds or the bird flu, and then novel H1N1, which is known as the swine flu. So for the avian flu or bird flu, that's going to infect mainly wild and domesticated birds. So chickens, ducks, turkeys will get this, and it can infect humans. So they call that a zoonose. So it can go from birds to humans. Symptoms for humans is going to be similar to common cold in more milder case, or maybe flu-like symptoms in more intense case. And for swine flu, they'll call it novel H1N1 because it's pretty newly discovered, actually. So a type of flu that first appeared in 2009. So they haven't really been studying it that long. It can actually stay on an inanimate object for 2 to 8 hours and still infect somebody. So a good thing to do, I know I've become kind of a stickler about this with my kids, is when we go to a restaurant, is get out a disinfectant wipe and wipe down their high chairs and just the table, because kids, they end up spreading their food everywhere and just eating off the table. So, the last person that ate there could have spread those diseases onto the surfaces that you're about to eat your dinner or lunch on. So it is good to clean those areas before you eat. Then we have SARS. So what that stands for is severe acute respiratory syndrome. So you have SARS-CoV-1, SARS-CoV-2. That's what we actually called. That's actually what COVID-19 was, severe acute respiratory syndrome, SARS-CoV-2, and they had a SARS-CoV-1. And for this one, it first appeared in Asia in February of 2003. So it actually had been around for a while before we saw the outbreak. That brings us to hepatitis. So we have hepatitis A, hepatitis B. So for hepatitis A, that's caused by an RNA enterovirus. And for hepatitis B, or what they call serum hepatitis, is caused by a DNA virus. So for the infectious hepatitis or hepatitis A, pretty low mortality rate, can spread to the liver and cause jaundice. You might get headaches, muscle pain, those sort of symptoms. And for hepatitis B, you might get headaches, joint pain. You could actually get liver damage from that and jaundice as well. Then we have the classic stomach flu or gastroenteritis. And for this one, you should think of vomiting. So it only lasts, you might only have it for a day. It can last longer than that. I've gotten it before, and usually you basically just puke your guts out for a day, and then you start to feel a lot better. So how to prevent getting this? So it's typically in school settings where this just gets spreads like crazy. Because students don't wash their hands after going to the bathroom. They share everything at school, and people get the stomach flu. So wash hands before eating and handling food, and after going to the toilet. Ensure all food are cooked thoroughly, and be very careful when handling a patient's vomit. If you had a kid that was sick, if your child got sick, there's a good chance you might get it from them. And really the fear with anything that causes diarrhea and vomiting is dehydration, loss of electrolytes. So just make sure you're replenishing. If your child has it, you're giving them plenty of fluids, giving them a Gatorade, some juice, something with some electrolytes in there. Then we got viral meningitis. So meningitis means inflammation of the meninges, which is the barrier that is surrounding and protecting the brain. Encephalitis is when you get swelling on the actual brain. So meningitis is typically going to be less dangerous than encephalitis, although it can be very dangerous and can cause permanent damage to your brain. Then we have AIDS, which stands for Acquired Immunodeficiency Syndrome, because it causes an immune disease where your body starts to actually treat its own tissue as foreign substances and starts to target them for destruction. Then we have the Zika virus. So for the Zika virus, it is also transmitted by the bite of a mosquito. It could be transmitted through sexual intercourse with someone who has the Zika virus. It causes teratogenic effects, so it will affect the developing baby in a mother who gets infected with the Zika virus. There are no treatments for it. There are no medications for it. You can't get vaccinated against it, and so far as I am aware, and it can create permanent problems for the developing embryo and the baby. So what are some things that they can do if you are exposed to a virus? Well, number one, don't get antibiotics because those are for bacteria. They do nothing to fight off a viral infection. Now, if you had the flu and now you're getting a secondary bacterial infection, pneumonia, well, yeah, take your antibiotics. A lot of people will just get antibiotics because maybe the doctor's not sure what's wrong with the person and it's just easy to prescribe antibiotics. But if you have a viral infection, it's not doing anything for you. Because viruses, we looked at the lytic and lysogenic cycles, we know that it gets into the cells. So that makes it even harder to treat because your immune cells aren't going to be able to recognize those viral particles when they're initially on the inside of a cell. So they're able to integrate into our DNA and start to spread that way. Now, there are drugs that prevent the copying of viral DNA. You have acyclovir, zidovudine, and Tamiflu and Relenza. They can inhibit some of these processes that will be involved with viruses. But really the best thing to do with viruses is to have immunity. Maybe you had been exposed to the virus several times like with COVID, or you had a vaccine and boosters to develop immunity in your system. Really prevention is all you can do. And with all the mosquito transmitted viruses, just wear insect repellent if you go out in the afternoons. Try to go out at times of the day when there aren't as many mosquitoes. Wear proper clothing. Be careful with going to foreign countries where they may have other viruses that are like dengue in Mexico. Like, going there ahead of time that's a thing that's being spread rapidly. So you need to be extra careful about mosquitoes so that you don't get those diseases. So teratogenesis, this would be the production or development that causes developmental defects in a fetus. So some of these viruses can act as teratogens. They can cause abnormalities to develop in the fetus. So maybe the mother isn't going to have any issues if they get that virus, but it might cause serious complications for the baby. So they have this acronym. It's called TORCH. And this describes a series of tests, blood tests that can be conducted to try to identify teratogenic diseases in pregnant women to see if there's going to be any complications with their babies. And you can also do those for the newborns. So what it stands for is T is toxoplasmosis, O is for other, like hepatitis B, R is rubella or German measles, cytomegalovirus, CMV, and herpes simplex viruses. So how can they be transmitted? Well, they could be transmitted through airborne particles. That's why when COVID started, it was all about the mask. Well, first I think it was no mask, and then it was like, get the mask, and then they're like, well, maybe it doesn't help. The only way for it to help was actually to have like some super intense mask that no one has. But a lot of viruses can be spread through airborne particles. So depending on like what environment it's in, a mask might actually help. Direct contact, of course, could spread it. It can be like polio. It could be spread through feces, contaminated water, or food. And then, of course, insects as a vector could spread the virus. So that is our part 2 for viral diseases.